Awesome. All right. So Dr. Rinaldi has a PhD in biology from MIT. And since experiencing hypothalamic amenorrhea, missing periods herself, Dr. Rinaldi has been on a mission to spread awareness of the condition on how to recover. And it's ironic because I have actually read her book and used it to recover myself. So it's really cool for me to have her on today. The book, No Period, Now What, which she actually published in 2016. And I didn't know that it was recently updated in 2019 to become more health at every size aligned. That is amazing. This book is a comprehensive resource. I would call it my Bible, especially at the time when I was in recovery, that underlies our current understanding of the triggers for amenorrhea and what steps to take for recovery and treatments to use for recovery and pregnancy as needed. So thank you for coming on, Nicola. I am so excited to have you.
I so appreciate you having me. This is really exciting.
Yeah, it's going to be a really good conversation. And we're going to kind of walk you guys through the overview of kind of what hypothalamic, I'm just going to call it HA.
Yes.
For the sake of the conversation.
It's a total tongue twister.
It's a mouthful for me, and I'm sure for you as well, to have to keep saying it over and over again. So we're going to kind of walk through an overview, what it is, how it's diagnosed, some signs and symptoms. And just because it's the first time that we're talking about it on the channel, but if you are looking for more in-depth information, I highly recommend picking up the book, No Period, Now What, because it dives into the science, it's got more recommendations, and you'll definitely want more information after this talk if this is something that resonates with you.
Great, thank you.
So what is HA?
So hypothalamic amenorrhea, the name really says it all. So the amenorrhea part is you're missing your period. The technical definition is for 3 months or more. It can also be, in some cases, like periods that are very far apart. We can talk a little bit more about that. And then the hypothalamic part is that there's a small area of your brain called the hypothalamus, and that actually controls your reproductive cycles. And so this is amenorrhea due to your hypothalamus being shut down or suppressed. That happens for a combination of reasons typically. It's usually some mixture of underfueling is pretty much the biggest driver. It can be intentional, it can be unintentional. So, somebody goes on a diet, like that was how I gave myself HA, was I decided to severely limit my calories and I was exercising a ton. So it's a combination of underfueling and then over-exercise, and the cortisol is generated when you do high-intensity exercise in particular, and then stress as well, so psychological stress. So those 3 components can be, it could be like super stressful event that happens can cause somebody to miss a period or 2. Typically, it doesn't cause long-term amenorrhea. But then if you have, stress and a lot of exercise, then you're more likely to become amenorrheic. And then if you throw underfueling into the mix, then, that's typically the biggest driver. So for many women with HA, it's sort of, it derives from often an increase in exercise intensity without then changing fueling, or just not understanding necessarily how much fuel our bodies need for different activities. Because I think that the message that's out there in the sort of general knowledge-based media, whatever, is, you need a certain number of calories a day, and, it's actually less than we probably need. And then, we don't think about how much energy our exercise is burning. And so we often, we think we're all doing all the right things health-wise in terms of, we're always told, lose weight to be healthy, exercise to be healthy. And, when you have those combinations, then that can actually be going too far and cause you to become unhealthy, in that you lose your period and have all the negative consequences that are associated with that.
Wow, you already dialed into my next question there. Why first? I appreciate that. I like to describe to my clients in kind of a general sense of the body just not feeling safe in any
Hmm.
way. Like it's, you've got that perfect storm. And, like you mentioned, I think it's really important that sometimes people have really good intentions where they're just trying to eat healthier, or, maybe falling into kind of diet culture and pursuing a healthier lifestyle, or feeling better or more confident. And sometimes, you don't necessarily have to be a marathon runner or an intense
Right.
exerciser to experience this. Now, in your experience, have you seen clients who maybe the physiologic stress is overriding, like say somebody doesn't really exercise, or they are really, eating intuitively and getting what you would consider plenty of calories? Do you see like mental stress ever be a main driver of HA?
It's extremely, extremely unusual. I mean, some people are like, oh, it's only stress for me. But then when I go into how they're actually fueling through the day, or, how much exercise they're doing, there are often things that they can change in that regard to sort of help their body to feel more safe. And, I don't necessarily describe it as safety. The way I think of it is that our body has a certain requirement for energy through the day.
Mm,
And if we're not providing that level of energy, then it has to shut things down in order to survive.
mm,
Um, so, there are things that our bodies have to do, like pump our blood and breathe and give energy to our brain. And it's like those are the most important things for survival. Everything else is kind of, more of a nice to have. And so it's, our bodies are trying to um, sort of take whatever energy we're giving them, and it has to keep us alive. That's like a number one, and
priority.
then everything else, yeah, everything else is just is extras, and particularly the menstrual cycle. That's definitely a nice to have, not a need to have, from the
Mm.
perspective of our daily survival. And so that is one of the things that's very easy to shut down. Um, so yeah,
It's kind of cool when you think about it, just in the way that our body is really smart in terms of prioritizing what it needs to use that energy for. If we're giving it limited energy, it'll go to our organs or our brain, and
yeah,
it says, well, making babies is not a priority, so we're going to shut that process down.
yeah, yeah. Our bodies are remarkable. I've learned so much about our physiology and everything through this, and just the different our hypothalamus doesn't just control our reproductive cycles; it controls everything. Like,
Mm.
so it secretes corticotropin releasing hormone that controls our adrenal glands. It secretes thyrotropin releasing hormone that controls our thyroid. It secretes oxytocin. It secretes what's the ADH, antidiuretic hormone, that controls the water balance in our bodies. It's like it's this major control center, and everybody tends to think of those other parts as being separate, but it's like the hypothalamus can control everything. And so I had one client who was on growth hormone and all these other hormones, and like, I really think you just need to eat more and cut your exercise. And, she was on like this whole cornucopia, and none of her doctors could figure out what was wrong with her. And it turned out, she followed the recovery plan, went off growth hormone, and was actually able to get pregnant a few months later. And, it's amazing how, when you really look at things with that in mind, that the hypothalamus is controlling everything based on energy balance.
Mm.
Um, it's actually remarkable how our bodies can recover in so many ways that seem all to be separate, but they're really not, because they're all controlled by that master regulator.
Yeah, and I'm just so excited for the work that you've already done and the work that you continue to do, because there's so many females who go to, specialists and herbalists and the top doctors in the cities, and they'll come and say, well, I've done this and I've done this test, and they put me on all these herbs, and they have done, and I've gone through that process myself, where
Mm-hmm.
particularly with my digestive issues, for the longest time I was trying to figure out why they were getting so bad, and how my health was declining so quickly. And at the end of the day, it came down to the fact that I just wasn't eating enough.
Mm-hmm.
And
It's amazing all the different things that can be associated with that. I think one that's that I sort of discovered the basis of more recently is having to pee more frequently. And so
mm,
women with HA often have to, often wake up in the middle of the night having to pee. And it's so interesting. So when our bodies don't have enough estrogen, which is one of the symptoms of HA, not a cause, the lining of the bladder actually thins and the urine penetrates more easily. And so our brains get that signal to pee more often than they would when you're normally cycling and you have this large increase in estrogen during the middle of each cycle. And so I think that's a fascinating side effect of underfueling and having a missing period.
and now I'm just thinking of menopause too, right? So when you're through menopause and estrogen is declining, you'll hear women say, like, I have to wake up and pee in the middle of the night. So is that kind of the same?
Yep.
It's the same thing, right?
Yeah, it is.
Wow.
It is. So many of the symptoms of HA are similar to what women experience when they have menopause, because hormonally the two situations are quite similar, because it's just a consistently low estradiol level and low progesterone level because we're not ovulating. So it's a different reason. When you have HA, it's because your hypothalamus has shut your reproductive system down. Once you've gone through menopause, it's because your body is just no longer cycling due to the biology of how we age. But the symptoms are often the same, and that's why we have a fairly good understanding of the long-term consequences of HA is from looking at the consequences for women who have gone through menopause. So things like decreased bone density, potential heart issues, and one that I have in the book that is not confirmed anywhere, but it's a possibility, is sort of an increased risk of early dementia or neurodegenerative disease. And I do know for women who are sort of experiencing extreme underfueling, that there can also be mental effects of that, sort of a brain fog, a cloudiness, just not being able to pay attention to things. So that's another thing that can improve when you give your body the fuel that it needs. Because I think something like 30% of the fuel we use goes to our brain. So
I tell clients that all the time when they're like, I didn't work out today, or, I haven't worked out all week, or I'm not, running anymore as much as I used to. And I say to them, your body requires a base amount of calories, your basal metabolic rate. And a lot of that is actually going to their brains. And, some of them are working, or, COVID has increased their stress levels, or they're in school and they're using more of their thought process and their brain fuel, and to remind them that your calories are actually fueling that.
Yeah, absolutely. That's something that we really don't think about, especially when you're like, I'm going to go on a diet. Well, which parts of your body do you want to not fuel anymore?
I love that. That's such a good question to ask. Which parts of your body are you willing to give up the fuel for? Wow.
Yeah.
So I do want to talk about the long-term effects, but first you had mentioned some symptoms. So you mentioned urinating frequently in the middle of the night, obviously not having a period. Did you say for 3 months total? Is that kind of the criteria? What would you say are classic symptoms of HA?
So missing period for 3 months or more is the technical diagnosis, but you can, if you miss one period and you've been regular for a long time, it is worth thinking about, well, have I made any changes in my diet or my exercise? And, or is it possibly due to stress? Because it's somewhat unusual to just miss a period randomly. I mean, it does happen, but there's typically some underlying cause. And certainly if it's if you're getting to 2 or 3, then it's definitely worth sort of examining. Have you made changes in your lifestyle, or what could be going on? So other symptoms, feeling cold all the time is another big one, because again, it takes energy for our bodies to keep us warm, and so that's another easy place for it to save energy. Brittle hair and nails is another really common complaint from sort of chronic underfueling. Dry skin, trying to think. Digestive issues is another one that's a big one, and that's, I'm really looking forward to chatting with you more about that, because I think that stems from, if you start going on a diet and then your body maybe doesn't have enough energy to make all of the enzymes and things that it needs to digest food. And so then you start feeling when you eat certain foods, and then it's like, well, which food should I cut out? And then you cut out more foods, and now you're getting even less energy, and now you feel worse and more bloating and more constipation. And, so what should I cut out next? And we have this idea that like everything that happens to our body is because of certain foods that we eat, as opposed to like, let's just eat more. And maybe that's really the problem. I mean, it seems that that's definitely the case for some people. I know it's not true for everyone, but.
Yeah, but for a lot of people, I mean, I can't tell you how many times, and this was me too. I got to the point where I was probably eating 5 foods total. I think, I would
Oh
eat one
man.
food, I would have a reaction. I think the foods were, it was green beans, white fish, chicken, asparagus, and like squash, and then I guess 6 rice cakes. And
Mm-hmm.
it was because, I would just eat something and then I'd say, oh, well, I'm bloated, or I had bad gas, or I didn't go to the bathroom that day. So it must be that food. And I was constantly trying to pinpoint what the food was that I was
Mm-hmm.
eating, which then just further exacerbated the issue, because then you're just chronically restricting your calories.
Yeah.
And so I
Yeah.
see clients do this all the time, and it's really frustrating because they're trying to figure out, is it gluten, is it dairy? And then
Mm-hmm.
you have
Mm-hmm.
all the stuff that's going on in the media that's telling you that all of these things are bad, and these fats are bad, and these carbs are bad. And then they're confused, and it's going to further
Yes.
drive their want to restrict, in hope that they're going to find resolution, because nobody wants to feel bloated or uncomfortable, or
Mm-hmm.
their intentions are so good. And it's just so sad to see a lot of people suffer in that way.
Yeah. Yeah. And I was just thinking about other symptoms, and I think there can also be sort of emotional and anxiety symptoms.
Mm.
So when you're chronically underfueling, you can have less patience, be more angry with people, and I think that's, I can't describe a mechanism for why that would happen, but that's another common experience. And people say, like, when I started eating more, I had so much more patience with my kids, or with my partner, or whatever. I mean, I
Mm.
think so. I think that's another big area where people can see improvements in their overall life when they start actually fueling their bodies properly.
I like to think of the Snickers commercial when he's hangry,
Uh-huh.
and he's like, "You're not yourself when you're hangry." And I know it's obviously a little, there's some nuances to that, of course, but
Yes.
just the idea that when your brain is occupied trying to keep you alive and you're not feeding it, then your focus is going to decrease. I've had a lot of clients who are working in high stress jobs, where if they're
Mm-hmm.
restricting and then they can't focus, and that's going to impact their ability to do their job, or show up in life as a friend or as a partner.
Yeah.
It can be really debilitating to life. And we think of it as just, okay, well, I'm just doing this to change my physical body or be a better
Mm-hmm.
athlete, or whatever it may be. But seeing all and just hearing all of these different ways that it can really impact us, it's like, is it really worth it?
Right. I would argue very much that it's not.
I would as well, absolutely. And so in terms of the digestive issues, restricting calories for long periods of time, I see a lot of constipation, and
Mm-hmm.
some people won't even realize that they are constipated because they might be having a daily bowel movement, but their transit time is so slow that that bowel movement is not necessarily completely emptying. Their transit time is slower. This can also lead to things like small intestinal bacterial overgrowth. Not always the case, but it's definitely possible. I would say dysbiosis is very common, because
Mm-hmm.
basically the imbalance of the good and bad bacteria, because you're restricting your food intake so much, and research has shown that that actually reduces the diversity of your gut bacteria.
Oh, interesting.
And what we know is that a diverse gut is a healthy gut. And
Mm-hmm.
this specific research was mostly done in clients who have anorexia nervosa, but their gut bacteria was significantly, the diversity was decreased, which is interesting to me, because you brought up the point about neurodegenerative diseases and dementia.
Mm-hmm.
And we have strong research to link neurodegenerative diseases to a reduced diversity in gut bacteria. So that
Oh,
could be
wow.
a possible mechanism as to how that happens. But it's hard to make that statement without knowing exactly, but
Right.
would make
Yeah.
sense to me just thinking about it. But also thinking about, where the calories are coming from too. So fats, which are very lubricating for our digestive system, carbs, which help to feed the healthy bacteria, the prebiotics, the starches that make our gut healthy. You mentioned digestive enzymes, so protein, which helps make stomach acid and rebuilds the lining of our gut and helps us make those digestive enzymes. I see a lot of clients who are coming to me, taking a bunch of digestive enzymes, and I'll say to them, are they helping you? Oftentimes they don't help, but it's why aren't we making digestive enzymes? Because if we're not making them properly, then we need to figure out the root cause as to why that is actually happening.
Yep.
So there's so much related to gut health. I could talk about all of it basically, but I think maybe we could go back to the long-term effects of HA and then maybe some tips for how to kind of mitigate some of these digestive issues, which have a bunch of ideas there.
That would be great. Yeah, so I mean, I think the long-term issues with HA, the biggest one I would say is probably on the bone density side. I have seen a lot of women who recover their cycles and have a really nice increase in bone density. A woman I worked with not too long ago, we got her cycles back, and within a year, she had gone from osteoporosis to osteopenia in her spine and osteopenia to normal in her hip, and that was at the age of 39. So you can see nice increases in bone density upon recovery, which is why I would strongly suggest to anyone who has HA, to work on recovery as soon as possible. Because you do build more bone in your teens and your 20s, and it definitely slows down as you age. I do think that there's sort of, upon recovery, there can be kind of a burst of bone building, similar to what happens in the postpartum phase when somebody stops breastfeeding, because during breastfeeding, there's a fairly significant decrease in bone density. Because if you think about it, your baby's bones your baby is tripling in size in the first year of their existence. And, that's a lot of bones that have to be built, and they get the calcium from you if you're exclusively breastfeeding. So, and that calcium comes out of your bones. So once you stop breastfeeding and get cycles back, there's a significant jump in bone density to basically back to where it was when you started breastfeeding, which is really cool. And so I think something similar happens with recovery from HA, but obviously, like the sooner you can do that and the less bone density you can lose over time, the better off you will be long term. I think that's probably the biggest long-term consequence. In terms of the heart issues and the dementia issues, that seems to be sort of less of a long-term consequence once you have your period back. It seems like things kind of normalize more quickly with the return of estrogen. But again, I'm not a cardiologist, and I think we really don't know a whole lot about those. So there is a study that's being done by Dr. Cassandra Schufelt out in the LA area, I think, that I'm looking forward to data from, because I've sent a number of women her way to participate in the study, and she's looking at changes in heart function with amenorrhea and estrogen and recovery. So I think that'll be really interesting to see.
I look forward to that. Absolutely. And you mentioned too, the mental health side of things as well. Like, we're obviously talking more maybe short term, and once you're through that recovery phase, these things can go away. But not having proper mental health, I mean, that's definitely a motivation. It doesn't. Some people will say, well, I don't want to get pregnant. It's kind of nice not having a period. And although sure, it is for a little while, but if you're not thinking about these other effects that you might not think you care about right now, but you will definitely care about when, especially if you're active and you decide you want to stay active for the rest of your life. If your bone health is suffering, you're going to start getting injuries. I see a lot of females getting injured, and they're coming to me saying, what supplements can I take and how can I improve? And we know
Just
in the
eat.
yeah, just eat more calories and proteins involved with bones, but
Mm-hmm.
calories are so important for bone health, and our gut bacteria. Having adequate balance of healthy gut bacteria is directly linked to bone health and bone rebuilding.
Mm-hmm.
And studies have consistently failed to show any improvement in bone health with calcium vitamin D supplements alone.
Yeah. Yep.
And you mentioned cortisol too, which cortisol has been well known to have deleterious effect on bone health, and having high cortisol is associated with the severity of bone loss in any kind of underfeeding.
Oh, I wasn't aware of that. That's really interesting.
Yeah, yeah. So I looked up some research studies before this, and I mean, I'm always looking at stress, because especially with COVID and its impact on health and digestion, stress is such a huge player in any
Mhm.
sort of health issue that we're talking about. So it's important to know that as well.
Yeah, it was actually really interesting. Right when COVID started, I had so many people messaging me like, my cycle is really weird this month. And I was like, it's stress. It will normalize. Don't freak out. Don't freak out more than you already are.
Yeah.
But yeah, it was super. I got so many messages about it. Like my cycle, I haven't ovulated yet this month, or my period is late, and I'm like, just it's stress. It was a really trying time, and still is. I think we've gotten a little bit more used to the new
Yeah.
normal for now.
Yeah, that,
Yeah.
and also, some people are, I work with a lot of runners in Boston through Wellness in Motion, and, the gyms are closed and people are
Mhm.
cooped up inside. So they're more inclined to maybe manage stress by running more, walking more, or doing these high intensity home workouts that all these influencers
Yep.
are posting on Instagram. And I think that has also played a role in fueling this condition with some females. I've also seen it go
Mhm.
the other way, where some
Yes.
people are like,
Yes.
well, I'm home, nobody's going to see me for
Exactly.
the next 6 months or so, so I'm not going to put so much pressure on myself. I'm going to eat whatever I want. And then, so there has actually been some really positives with some of my clients, which just makes my heart happy, because
Yes,
it's
absolutely.
forcing you to kind of reevaluate, why am I trying to fit into a size 2 jeans? I haven't put jeans on in 6 months. So, I'm not
Hmm.
getting in my head about it, which is, a really positive thing to see. Unfortunate that a pandemic had to, open that realization up, but
Yeah.
looking at the positives of what that can do. Now, we're not going to go into too much detail, but because I know it's a heavy topic, but birth control. If someone
Mhm.
isn't getting a period back, is birth control the solution? And kind of how can that kind of mask maybe what's going on?
So I really, really do not like birth control or hormone replacement therapy as a quote unquote solution for AHA, because yes, it can give you a bleed, but it does not address the underlying issues at all. It's a band-aid. Um, and the hormones that are provided are, there are over 20 hormones that are involved in our menstrual cycles, and the birth control pill provides two of those. So, I think there's an idea that, oh, it'll protect your bones, and it does ameliorate some of the other symptoms, like particularly the frequent urination, things that are directly related to the low estradiol levels. But to think that those two artificial hormones are going to replace the 20 that normally cycle through our menstrual cycle seems a little unrealistic to me. And again, it's not addressing the underlying issues. It's not going to make you feel emotionally better. In fact, birth control pills often can make people feel more depressed or more anxious.
Mm.
And it's not, the studies have found that the birth control pill in particular can maintain bone density where it is, but it's not necessarily going to build bone density, and certainly is not as good as having natural menstrual cycles.
Mm.
The hormone replacement therapy seems to be a little bit better, because the way that the birth control pills is metabolized is through your liver, and that metabolism actually suppresses another hormone called IGF-1 that is also involved in bone density building. So
Mm.
it's, so the hormone replacement therapy is better in terms of bone density, but it's still, the idea that you should be on something like that for the rest of your life, rather than maybe making some changes to your diet and exercise, I think is not one that I support. I think, having natural menstrual cycles is way better. And interestingly, you talked about not having a period can be kind of nice. I just got a menstrual cup, and oh my God, it's life changing.
I have one. I have one.
It's like, I mean, I played ice hockey, and I had a little bit of leakage because I should have emptied the cup before I played. But even then, I don't feel it, and it basically is like you don't have a period until you go to the bathroom and empty the cup and clean it. And so it's like a whole new world. So I totally suggest that to anyone who's listening.
That's a great, I didn't get one. My cousin she's just kind of randomly into like weird things, and she saw a discount for one on Groupon, and she was like, want to get one together? And I don't know why, but I was like, yeah, sure. And, we both tried it out. And at first I was a little, how does this work? I don't know how I feel about this. And now I'm obsessed with it. And it's so nice not having to buy, first of all, you save a ton of money. And second of all, you save the hassle of it. And it's kind of like, it's not even
And
there.
it's so much better for the environment. I mean,
Yeah.
so many reasons.
Yeah, absolutely. How about an IUD in terms of, that makes you not have a period. And I think some people are concerned of, is that healthy to not have a period? Like hypothalamic amenorrhea aside, kind of the idea of having an IUD forcing you to not have a period. What are your thoughts on that? Or is that too much of a heavy question?
So the copper IUD, I believe you do continue to have periods and menstruate. So if you stop bleeding on that, then again, you need to do a check-in with regards to what am I doing lifestyle-wise, eating, exercise, stress, all of that. On the hormonal IUDs, I actually just got mine taken out, and I decided to go on it because I looked at the research, and it seemed that about 80% of women do continue to ovulate regularly while on the IUD, and that was the case for me. So I tracked ovulation through temping, through cervical mucus changes. I had my hormones I had blood drawn a couple of times that confirmed that I was ovulating. And then I would get like this mini bleed, like a little wipe of pink would be my like quote unquote period. Occasionally I'd need a light days pad for a couple of days. So, I think that can be a good choice for long-term contraception. But I think learning to track your ovulation and making sure that you are ovulating, I think, is important, because the estradiol levels during a normal cycle, you start with an estradiol level of something like 20 to 30 picograms per mil. That goes up by about 10-fold in the middle of your cycle, and then stays up by about 5-fold between the time when you ovulate and when you get your period. So that's a significant increase in estradiol. And then progesterone actually stays low until you ovulate, and then goes up by between 20 to 40-fold. So again, that's way more than you get from from just the IUD or from from birth control pills or hormone replacement therapy. And so I think that, and both of those hormones are important for bone density and, a lot of other things. So I think that's why I don't see birth control pills, hormone replacement therapy as being as good for our systems as natural menstrual cycles. And the IUD can be okay if you do continue to ovulate, but I think that that's something that you can't necessarily know in advance. Although, like I said, the study I found said that about 80% of women did continue to ovulate on the IUD. That's because it's a very localized low dose of progesterone. So it works by keeping your uterine lining thin, so there's nothing for an embryo to implant into, and that's why you also get very minor periods. It also has other mechanisms by which it can prevent pregnancy. But so it's not systemic, so it's not, the level of progesterone is not high enough to go to your hypothalamus and suppress your hypothalamus, which is what the other forms of birth control do. So I think that's why you can continue to ovulate on the Mirena or the Skyla.
I like the sound of that, the sound of not suppressing your brain from doing, your hypothalamus from doing what it should be doing. And I actually had a client yesterday who said to me, she's on the IUD, the non-hormonal IUD, and she said, we started kind of really focusing on fueling and adequate nutrition and really focusing on gut health. And she started noticing, as she started, eating better and reducing her exercise, that she actually started to notice like increased hunger and certain hormonal changes where maybe she wasn't ovulating before. I think it's really important that you just mentioned, even if you're using an IUD, to still do things like tracking your basal body temperature, tracking your cervical mucus, so that you can still see what's going on with your body and still have some good indicators of health.
Yeah, absolutely. I think tracking ovulation is incredibly important because there have been a number of studies that have found that particularly in those who exercise a lot, um, even if you're having a regular bleed, there can be other issues with your menstrual cycle. So you can have what's called a luteal phase defect, which is when the luteal phase is the time between when you ovulate and when you get your period. And if that's short, A, it means you can't get pregnant, and B, you also have a much lower level of progesterone, which then can impact your bone density. So having a normal length luteal phase, which is sort of 10 to 14 days, I think is definitely something to be aware of and to track. And the other thing that can happen is that you can have anovulatory cycles. So that's where you get a bleed, but you didn't actually ovulate.
Mm.
And that's something like a third of women that exercise have anovulatory cycles. So I think it's really important to do the things that you were suggesting. Look at your cervical mucus and how that's changing through the month, and track your basal body temperature. Maybe use ovulation predictor sticks to figure out, am I ovulating? When do I ovulate? Are my ovulations consistent? And that can also be a really good marker for if if you're making changes to your eating or your exercise, like how is that affecting your cycle? Is it making your ovulation late? Is it making it earlier? Is it
Mm.
shortening your luteal phase? Like understanding your menstrual cycle to that level, I think is really, really important and super helpful, whether you want to get pregnant or not. But certainly when you do want to get pregnant, knowing when you ovulate makes a huge difference to your potential success rates.
Mm. And also digestive issues, because I specialize in gut health, I'll have clients say, I don't know, I got really constipated this time, or I had really bad diarrhea this day. And, I feel like I'm noticing a trend, and I'll say, well, where are you in your cycle? And
Mhm.
where were, I was really hungry last week, or I was really low energy. And learning where you are in your cycle as a female can be such a powerful tool for adjusting your nutrition, your exercise, and really working with your physiology rather than
Mhm.
saying, oh, well, I had diarrhea. Well, okay, did you just get your period, and did your hormones completely drop? Or, was
Yeah.
your estrogen really high? Or are you estrogen, excess? And so there's something really powerful about gathering that data and just understanding your body on a deeper level so that you can make those connections and possibly improve those symptoms, or just kind of have the knowledge to know, okay, I was
Mhm.
hungrier this week. That makes sense. I need more food because
Yeah.
I'm, in this phase of my cycle.
Do you find that those kinds of things vary from person to person in terms of when during their cycle they feel hungrier or might have different digestive issues, or is it consistent between people?
I would say it definitely is different. I've noticed clients who have said that they feel a lot more hungry on right before ovulation or right during
Mhm.
ovulation. And I've also had clients who it has been right before their period that they get really hungry. And there's different reasons also why that could happen. It could be that they're not getting enough omega-3 fatty acids, and there's a lot of inflammation going on in the body. It could be, some sort of hormonal imbalance where that could be contributing to those symptoms. But more often than not, I do see a lot of my clients will say as soon as they get their period, their stools are much looser. And if they're
Mhm.
not having a period to begin with, they're always going to err on more of the side of constipation.
Uh-huh.
Yeah.
Fascinating.
It's really cool. It's really cool, but it's also very complex, and
Mhm.
that's why I always recommend just kind of doing the tracking side of things. Although it can seem tedious at some times, it's helpful for me as a clinician to kind of make my recommendations, but also for them to make those connections in the brain so that they can kind
Mhm.
of be motivated to tap in a little bit more.
Yep.
Now, eating disorders are definitely an area where I see, a lot of digestive issues, and a lot of people don't have to have an eating disorder to have what I call the functional gut disorders of things like irritable bowel syndrome, gastric reflux, bloating,
Mhm.
constipation, diarrhea. But up to 98% of these patients who have disordered eating are more likely to have these functional gut disorders. And when you put that on top of the fact that the person maybe already doesn't feel confident in their body or doesn't feel, great to begin with, having constipation, bloating
Mm-hmm.
is kind of a recipe for disaster in my practice. I see it all the
Yep.
time. And a statistic that I also found really interesting was that childhood GI issues are a key risk factor for later development of having an eating disorder,
Oh,
which
wow. Interesting.
resonated with me because when growing up, I was not breastfed and I was diagnosed with lactose intolerant as a baby. And then I had frequent antibiotic use my entire life. So I was
Mm-hmm.
really kind of set up for not having a very healthy gut. And that definitely led into my orthorexia and some of the habits that I had. And it was almost like a PTSD of like, I had a hypersensitivity to any sort of bloating or any sort of reaction that I had in my gut that actually fueled me becoming more restrictive.
Mm-hmm.
So that is an interesting statistic. So I always ask that in my intake form about, history of antibiotic use or the method that they were born C-section versus vaginal, because that also impacts your gut bacterial composition,
Mm-hmm.
likely will also bring me back to, okay, well, did you always have digestive issues growing up? And people will say, oh yeah, I've been constipated my whole life, or I've always gotten really bad stomach aches, or really had bad bloating for much of my life. And those things often kind of lead to, potentially the development of HA. It definitely can increase the risk for that.
Interesting.
Yeah. So I think we should definitely touch on some tips for people to resolve GI issues if they
Mm-hmm.
are recovering from HA or if they're coming back from any type of restrictive eating. I see a lot of clinicians telling clients that, especially gastroenterologists, they'll say, well, once you restore your weight and just go through the refeeding process, all of your GI issues will go away. And I've definitely seen this. I have
Mm-hmm.
seen this where I've had a client who, you know, we restored her caloric intake, we reduced her exercise, and she was, I'm totally fine. My digestive system is, running smoothly. I'm having a daily bowel movement. I don't have bloating. But a lot of the times there are clients who do need some sort of extra support. And part of that is nutritional deficiencies. Part of that is, maybe some sort of dysbiosis, which would mean maybe doing some probiotics to kind of just replenish it, really focusing on probiotic rich foods. I have a very food first mentality because,
Mm-hmm.
you can get so much variety of probiotics and prebiotics if you're eating a whole food source. But some people do need a little support, whether it's, stomach acid, having HCl, betaine HCl to kind of support stomach acid. But a lot of those things are typically temporary. And then once
Mm-hmm.
they go through that kind of healing process or just kind of, reestablishing which nutrients are maybe critical. Omega-3s is a big one too. Omega-3 fatty acids, they actually make their way to the colon and can impact the gut microbiome in a really positive way. So if
Mm-hmm.
somebody isn't getting enough omega-3s, that can help increase diversity. So I could go through, every sort of nutrient, magnesium and iron and calcium, but overall it's making sure that you have enough calories and you're eating a balanced diet. And that's why I always recommend working with any sort of dietitian, just to have them have a bird's eye view of your diet and see what you
Mm-hmm.
could potentially be missing. I know you mentioned reducing fiber. That's a
Yep.
big, big tip. Do you use that with a lot of your clients?
Totally. I mean, I think one of the things that people tend to do as they sort of fall into the HA orthorexia uh, pit is, lots and lots of fruits and vegetables, and enormous salads for lunch, and that fills you up a lot, but it doesn't provide very much energy.
Mm,
So cups and cups of spinach or whatever, and I think that a lot of times people do find that if they reduce the amount of the greens and the vegetables that they're eating, that A makes space for other more energy dense foods, and B actually does help them digest things better, because I think there's we do need, like you were saying, we need the proteins, we need the fats, we need the carbs. And so if you're existing just on, just on salads or, a
I call
lot,
it roughage.
heavy, yes.
Just roughage. It's just roughage. It's meant to be part of the whole system of, you can't just
Yes.
have a bunch of, vegetables sitting in your GI tract, imagining how comfortable that's going to be. And
Lots of fermentation going on there, right?
yeah. So if things aren't moving properly and you've got to, talk about FODMAPs, a lot of people will say, you go to your GI doctor, they say, well, try the low FODMAP diet. And all they're eating is fruits and vegetables. And all of those fruits and vegetables are on the FODMAP list. And so what really we're looking into is, okay, well, you're eating all these fruits and vegetables. What happens when those fruits and vegetables sit in your GI tract because you're not eating enough? Well, they ferment, they create gas, constipation, bloating, and you feel like crap, basically.
Yes. Yeah.
So reducing fiber is key. And, living in a culture where white rice is bad, white potatoes are bad. These are great foods. They're incredibly great for our digestive system. And as you mentioned, cauliflower rice should not be your fuel for a workout or for your brain for a long, study session. It's not appropriate.
Yeah. Yeah. I mean, I think that there are so many diets out there now where you're encouraged to cut out X food group or, Y food group. And I really find that most people, sort of function best when they're getting some of everything, some protein, some fat, some carbs. And, the exact ratios don't matter. It's not like I'm going to say you need 25% fat and 25% protein and 50%. No, it's like, some of everything. And, some days you might have more carbs and some days you might have more fat and some days you might have more protein. And that's fine. Our bodies can deal with that as long as you're on this base level of giving it enough fuel. It's when you're under fueling and then you're cutting out certain food groups and things tend to go a lot more haywire.
Yeah. And it's that intuitiveness too. I mean, I had a client who was probably eating 20 grams of protein a day. And I said to her, there's no way this is good for your hormone balance, your gut health, whatever. And I said, let's aim for, 98 grams a day, go for 98 grams. And she got to a point where she hit 70 and she said, 70, like my cravings have gone down. My bowels are moving really well because my calories have just total gone up. But she said, 98 just feels really high. Awesome. Well, then 70's your number then. Stick with 70, that intuitiveness too. This is an interesting study that I found about fiber, that researchers found that women with the highest fiber intakes actually had the lowest estrogen levels over the course of cycles. I'm sure you've seen this. And they also had lower levels of reproductive hormones, progesterone, luteinizing hormone, and also that high fiber diets decrease beta glucuronidase, which is the enzyme that is basically responsible for reabsorption of estrogen in the colon. And then fiber also binds to estrogen in the colon, in the intestine. So if you are eating too much fiber and reducing your estrogen, and we know all the benefits of estrogen, and you don't have a period, then really focus on balance, getting those, white potatoes are not bad. White potatoes are good. In addition to lots of healthy
Sugar
vegetables.
is not toxic.
Oh my gosh, no. And then so variety, as I mentioned, a diverse gut microbiome is fed by a diverse diet, and by including all of these foods, which can also be really freeing when, I'll have a client who comes to me and she's been following the low FODMAP diet for, I don't know, a year or something. And because a doctor told her that would help solve her gut issues. And I say, forget the low FODMAP diet, just try eating everything. And just, you don't feel better the way that you're eating anyway. Eating low FODMAP, if you've gone on this diet and you're only seeing your symptoms, get worse, then let's go the opposite way and see what happens. And oftentimes we see that adding in that variety, not only mentally better, but, your body starts to thank you.
Yeah, absolutely. And your brain too.
Yeah. It's so true.
I think that's one of the great things about recovery is just the decreased focus on food and exercise means that you can do all sorts of other things with that time. You can spend time with friends and family. I mean, maybe not so much right now, but in general, I think, the best part about recovery is not necessarily physical. It's the mental and emotional side of enjoying life more because you have the capacity to do that.
Mm. Yeah, you mentioned, being snippy and having low patience. And
Mm-hmm.
I just remember when I was under fueling, I was not fun to be around, and I didn't want to go to certain social events because I would have rather, worked out or have focused on
Mm-hmm.
my food, and would have been afraid of, would I eat something and upset my digestive system? There's so much more to life than focusing on your food and your exercise, and sometimes it's hard to hear that and actually understand it, but when you go
Yeah.
through it and you trust the process, it is the most liberating experience.
Yep.
And
Yeah.
yeah, so stress, stress is a really big one, and it's easy to just say, well, reduce your stress, but doing things like yoga and meditation, calling a friend, coloring. I color sometimes. My boyfriend and I have done that on the weekends before. Whatever it is that can help you. A lot of people, especially my clients, exercise is a stress release for them, and it's hard for them to take that away. So
Yeah.
we'll try to keep things in, like light walking, and especially outside, helping to
Yes.
elevate cortisol in the morning, and then normalize levels in the afternoon. But what are your recommendations for that? Because that's a tough one. I struggle a lot with clients who tell me that this is my stress release. How am I supposed to reduce activity?
Well, I think one of the things that's helpful to understand is that the reason that exercise feels good is because of the beta endorphins, and those actually also help suppress your reproductive system. So it's all part of the kind of cortisol stress system. So it feels good, but it's actually, that feeling of feeling, that feel good feeling is actually suppressing your system even more. So I think really focusing on more mindful exercise and not the high intensity variety, but like going for walks outside, I think is hugely helpful for mental health. And, it feels good to move our bodies. It really does. And, I absolutely believe that exercise is incredibly healthy for us. At the right times. I think when you have HA and you're trying to recover your period, it's very clear that high intensity exercise slows down or even can prevent recovery entirely in certain people. So taking a break, you have to think of it like an illness. And when you have the flu, you lie in bed for a while because you just physically can't move. If you've broken a bone, you put a cast on it and you don't use that bone for a while. So it's the same thing with recovering from HA and exercise. And so I think finding other activities to take up the time that you used to spend exercising, whether it be something like finding a show on, Netflix or whatever that you really enjoy, that can be good. It's so easy to binge watch things on Netflix.
So easy, so easy.
Next one plays,
Are you still watching? Of course I'm still watching. Let's go.
I actually finished a cross stitch when I was resting from my HA. I was doing a Beatrix Potter alphabet sampler, and each letter took me about 26 hours.
Wow.
So that was a good use of my time. And I was sitting still, I would sit down and watch TV and do some cross stitching. So I was still occupying myself in a way that felt productive, right? Not just that's taking
not
up some
scrolling through social
like
media and comparing yourself to other people, or
well, this was in the days before social media.
Yeah. Oh, yeah, that too. I think it's I was looking at someone's apps the other day. They were showing me like all this. It's Strava. It's an app. I'm sure you're familiar with it, where you can kind of look at what everybody else is doing and what their run was or their biking was that day. And I remember seeing it, thinking, "Gosh, if I had seen that when I was during my recovery, I would have just lost it. That would have been such a trigger for me because."
Oh my gosh, absolutely.
Yeah. So
yes,
intentional.
I have an app like that I use. I have a heart rate tracker, but I don't I'm not connected with anyone else. I just have it for me, and I like seeing how my heart rate changes with different types of exercise. Like I still love ice hockey. That's been my thing for many years, and watching my heart rate go up and down as as I'm on the ice and off the ice. Like I find that fascinating. But I don't need I don't compare that with anyone else, because really what anybody else is doing is immaterial to your own life. And I think that's, you know, like you said, social media is horrible for that because we're constantly comparing. And so I think especially during recovery, getting, you know, unfollowing people that don't, you know, that aren't encouraging recovery, that are making you feel this, you know, comparison trap, like I'm not you know, I'm not as good, I'm not doing well. Like unfollow those people. You know, you don't have to necessarily like unfriend people or whatever, but just don't, you know, just
You can
don't
mute
follow them
accounts
anymore.
and things like that
Yeah,
too.
yeah,
And, you know, there's so much out
yes.
there, and be intentional about it. Be intentional when you spend your time on there. And an interesting point too, to just bring up about exercise is that research shows that if you exercise too much, your gut bacteria shifts in a negative way. So some
Mhm.
exercise can benefit you in a positive way, but you can actually create more digestive issues by exercising too much, too intensely. And that's, you know, I have a client spot on where, you know, gets acid reflux as soon as the intensity starts to become too much. And that's because this
Mhm.
dysbiosis starts to come. And then as soon as we cut back, you know, normal bowel movements, no bloating, stuff like that. So it's
Mhm.
your other point about individualization and not comparison. Somebody might be able to be at, you know, a certain level of body fat, a certain amount of calories, still get a period, be healthy, happy.
Mhm.
And if you compare yourself to that person's journey, then you're setting yourself up for failure, because that's not your journey. It's a totally different
Yeah,
human being.
yeah. And that kind of brings us around to another point that I wanted to make earlier is that there's no one size fits all recovery. You know, everybody's recovery is different, and everybody's journey into HA is different. So, you know, often people think that it's only people who are anorexic, like teeny tiny, or who, you know, you know, Olympic level athlete, like exercising hours and hours every day, and none of that is true. So I've seen people with HA at all body sizes, all body shapes. I've seen it in people, like some people don't exercise at all. Some people are exercising multiple hours a day. So it really doesn't matter what the specific parameters are of you know, of an individual person. If the period is missing, then that's really you know, that's telling you that something isn't right for that person. Like whether, you know, how that compares to anybody else is
Mm.
really immaterial, because we all have unique genomes and unique environments that we grow up in and that we survive in now. So it really, you know, there's no particular magic numbers in any of this, like no body fat number, no weight number, no BMI that says above this you will be fine and below it you will have HA or whatever. It's, you know, everything is very unique and individualized.
Which is hard for people, right? Because it's, you know,
Yes.
you want a number, you want to say, okay, well, once I
Yep.
hit this weight, I know I'll get a period, or I know I'll be healthy, and it's unfortunately, I remember, you know, my endocrinologist saying, well, what weight did you get your, you know, first period at? And I was like, well, first of all, I was 9. So if I was the weight I was at when I was 9, we'd have an issue. But
Yes.
when I had a healthy period, I said, okay, well, what was your adult weight? And I held on to that weight so much where I thought, oh my gosh, okay, that's the number I'm striving for. And it really just derailed my progress, because then I wasn't intuitive about anything. I was really just focusing so much on a number versus tuning into my body and just, you know, figuring out what felt right.
Yeah. Yeah. And I mean, I think that's a really good point. We often think, oh, I should be the same weight that I was like X many years ago. It's like, no, our bodies change and grow and mature. And, you know, there's nothing magic about any number. So, I mean, I generally encourage people not to even weigh themselves, because that number actually tells you nothing about your health or anything else. It's just something that gets in our heads and kind of discourages any sort of progress towards recovery. And, you know, I mean, I was over at my mom's the other day, and I found a notebook of hers, and she weighed herself every day for years on end and has it all like written down in this notebook. And I'm like, why? Like, what was the, I mean, I can't ask her. She unfortunately has Alzheimer's, so I can't ask her what she was thinking. But it's just like, what was going through her head that she thought that this number was so important that she had to write it down in a journal every damn day? Like, you know, I mean, it's,
That makes me so sad. And
yeah.
it reminds me of a time when I worked in a nursing home as a clinical dietitian. And one of the women said to me, her best advice for me getting older was keep a diary of really positive things so that one day you can go back and read it and just smile, because she said, I sit here all day and that's the only thing I have to look forward to. And if you just kind of like pull yourself out of diet culture for a second, or pull yourself out of, the negative thinking, and think of those two scenarios, when you're old and you're maybe in a nursing home or you have Alzheimer's, do you want to look at the journal that has a list of all of your weights, or do you want to read a journal that has, the times when you shared a cupcake with your best friend, or the times when you enjoyed a glass of wine with, your mom, or, that's a powerful thing to ask yourself.
Yeah, absolutely. That would be a beautiful journal to read. So
I know.
Yeah.
Yeah. So in terms of the gut stuff, I would say, also eliminating diet foods. There's don't label any foods as good or bad, but I mean, they're adding artificial sweeteners to things. They're adding all these binders, and they're adding these things because they're taking the gluten out, and they're taking the sugar out, and they're taking the fat out. And those are things that are very likely going to make your gut worse. So rather than choosing a keto bar, eat a full fat, high calorie bar. Because I'll tell you what, the impact that has on your gut bacteria is going to be much healthier than the impact that the artificial sweeteners is going to have on your gut bacteria. And, from a health standpoint, from a bloated standpoint, digestion standpoint, you're going to feel better if you just eat whole, real foods. And then, I think those were my biggest takeaways, is just, reducing your stress, really reduce your fiber, focus on balance of all types of foods, make sure that you're working with, at least meet with a professional once to just make sure you're getting your omega-3s and your calcium, and make sure that you understand just on a general level what types of things you do need to be eating, eliminating those diet foods, reducing stress, and reducing the stress of exercise. Is there anything else that you would kind of add or I guess what would be your 3 main takeaways for the listener about if they are experiencing HA, what could they do today, or what would be your biggest advice that they could implement right away to kind of, I guess, just make their journey a little bit more, other than buying your book, obviously, because I'm going to push that, of course, because it's necessary and it's important to read it. But what would be your 3 main takeaways?
I think number 1 is making sure that you're fueling your body properly. That's eating throughout the day and getting enough energy, eating all the foods. I mean, really having nothing off limits, because, even if there is a food, like, sugar is being demonized at the moment, and, but our bodies have enzymes to digest sugar, and it breaks down into molecules that our bodies can use for quick fuel. Even if it is toxic, I think that it's not like one cookie is going to automatically cause diabetes, or, whatever it is. So I think just sort of pushing back on some of those, so I think maybe my number 2 thing is pushing back on some of the diet culture stuff that's out there, and just really understanding that so many of the things that are pushed on us are stemming from a place of enormous fat phobia, and don't do this because you'll get fat, and it's so many things that we do are out of this fear of an increase in body size, and the idea that somebody in a larger body is less valuable has been permeated throughout our society, but that's totally not true. Like, our body size has nothing to do with our value. And so I think pushing back on a lot of those messages that we get, and really thinking critically about them, and why am I being told it's bad to eat at night? And because I think that's one thing that is often pushed on us, like, don't eat at night, don't eat at night. It's like, well, why? Because the idea is then the food's going to sit in your, you're not as active, and so more of the food is going to go to fat. But our fat is actually a hormonal organ. It converts testosterone to estradiol, and it generates leptin and adiponectin, and those are actually things that our bodies need. So this idea that like fat is bad, I mean, it's just, it's
protects our vital organs, including our
yeah,
digestive
so
tract, and
many things that it's
keeps
good
us
for.
warm. And
Yeah.
yeah, I think that's a really important point, is just, you know, body size is very sensitive for a lot of people, and we need to remember that a lot of these messages that we're getting about what's good or bad, they're preying on our insecurities. This is a
Mm-hmm.
business, this is an
Yeah,
industry
absolutely.
that knows where we are vulnerable, which is
Mm-hmm.
so sad and twisted when you think about it. But it's also can hopefully be really empowering for people to realize that it's not coming from a place of what makes you truly worthy. It's coming from a business industry that knows exactly where your vulnerabilities are and how to target you in a way to keep you a consumer. And when you realize that, I think first you kind of get mad, right? You
Yes.
do like the 5 stages of grief where you're like, well, I'm pissed. That's ridiculous. Like, how could that, be? And then you kind of go into the acceptance phase where you recognize, okay, well, that's the way it is. How can I manage that and find a healthy relationship with myself? And some of the tips that you mentioned about, finding a positive group, like your Facebook group is fantastic. I mean, anytime that I'm having a bad day and I go and read
Mm-hmm.
someone experience, and okay, like my body's changing and there's a lot going on, but let's focus on the positives, and understanding that you might never love your body 100%. You might never be completely satisfied where you are, and you don't have to. Like, that's not necessarily the goal, is to absolutely be comfortable with where you're at all times, but understanding that your body needs to be healthy and that should be a
Mm-hmm.
priority. And it's a journey of learning to have self-love, despite the fact that you might not love every single part of your body.
Yeah. Yep. And
Well,
then I think the number three thing would be cutting out high intensity exercise. Cutting down, cutting out, because I really continually see the impact that has on people recovering missing cycles and just recovering in general. Like, I think that there's so many times where we get into this idea that, if I don't exercise, I'm going to lose all my fitness. And, if you take 6 months off, then yes, you do lose some level of fitness, but it actually comes back really quickly. And so I think, again, there's this fear aspect that's built into it, and that's also based on fat phobia and just this idea like, if I stop exercising, I'm going to turn into a puddle of jelly, or whatever. And again, it's not really based in fact. And I think taking some time off of exercise and seeing that, oh, my body doesn't actually change that quickly, and I don't lose my strength that quickly. And it's like, oh, okay, so I can take rest days, and that's okay. And it's actually probably healthy for me to take rest days. So I think that sort of changing our mindset around exercise and how important it is and how often we need to do it and everything, I think that also can be really helpful for sort of long-term having a healthy relationship with exercise, where yes, like I said, exercise is healthy, it is good for you. But if you don't exercise on a particular day because of, XYZ happens, that's okay. And I think learning that by taking some time completely off the high intensity exercise can really, again, make your life much, much more easy and free to live in, because you don't have to stress, like, if I miss my workout one day, whatever, I'll do it tomorrow, or I won't do it, or, no big deal, like, I'm going to be fine.
yeah.
So, yeah.
I can definitely relate to that. And I would think a large part of the reason why I became a dietitian was because what I needed to kind of, not, I would say convince me, but to motivate me to make the changes, was to learn the actual science behind it. And so when
Mm-hmm.
I teach my clients, when cortisol gets high because you've been doing high intensity interval training, that actually can create fat storage. It can actually create more digestive issues. When they understand that, and this is not everybody, some people don't operate this way, but a lot of my clients will respond really positively to that. And it's also very empowering when you can
Mm-hmm.
look at an advertisement for, lose 30 pounds in 2 weeks, and you're like, well, that's not healthy,
That's
and that's coming
right.
from muscle mass, and that's a
Or,
good way to
your liver,
rebound.
your kidneys,
Yeah. Yeah. So I think when you're able to, I really focus on education with my clients, because when you understand, education is power. Simply
Mhm.
put, education is power.
Yep.
When you understand what's physiologically going on in the body and what your body needs and how it responds when you fuel it. It's just like a magical, beautiful thing,
Yeah.
especially to be a female. And when you fuel it and you nourish it, it responds in such a positive way and you feel great. And, just remember that.
Yes, absolutely.
Yeah. So I could talk about this all day with you. It's
I
just such
know.
a such a fun, but very, it's an overlooked topic, and a lot of clinicians have normalized not having a period, and
Mhm.
that's why you've done the work that you've done, is, your own experience and empowering other women. And so I'm just so grateful for you and your book. So you work one-on-one with people, is that correct?
I do, yes.
Okay. So
Yep.
if someone is interested in working one-on-one with you, and you don't just work with people with HA, you also work with people who are trying to get pregnant.
So it's mostly people trying to get pregnant with or after HA.
Okay.
So I don't really deal with other forms of infertility, but I certainly can help guide people through sort of the process of getting pregnant and all the different fertility treatments that are available.
Okay.
Um, yeah, generally, I'm working with women that do have or have had HA.
Yeah, I had one particular person ask me prior to the episode if you had any advice for someone who's trying to think about family planning after going through HA. So I know we're kind of like wrapping up, but do you have any like general statements to answer that question?
Well, I think tracking your cycles is, I think that's really a great way to do that. And, knowing the times of the month where you're actually fertile and likely to get pregnant and using some form of contraception during those times. I think that understanding our menstrual cycles is hugely important for those of us who have them. And, so I think that would really be my recommendation is learn your signs for ovulation, and, you're fertile for the sort of 5 to 6 days before you, probably 5 days before you ovulate, when you're having egg white cervical mucus. And so learning about that, maybe cervical position, all of those things. It's actually so fascinating when you kind of put it all together and you have that knowledge. And like you said, the education, I think, is really, it's magical to really understand what your body is doing and not just be surprised when your period comes every month.
Yeah.
But it's like, I know I ovulated on X day, and I know my luteal phase is, 12 days long or whatever it is. And so,
Know the
I
details.
get my period, and yeah.
Yeah. So use an app. I mean, that's what, a lot of my clients will get them on an app and they're like, well, I track my period. And it's like, okay, but what
Mhm.
about everything in between that? Because that's
Yeah,
important
yeah,
as well. So
yeah,
that's good. That's
super
good advice
important.
for her. I appreciate that. Now, the most important question is, well, so where can people find you if they're interested in working with you?
So they can book appointments with me at noperiod.info/appointments.
Okay.
And if anyone's interested in getting the book, it's at noperiod.info/book. So nice and easy.
Awesome. And then,
um,
sorry, go ahead.
I was going to say, and the support group is noperiod.info/support.
Yeah, and it's an amazing, amazing group. Every time I see a notification, the females in that group are so inspiring and empowering and vulnerable. And it was a huge, huge, I honestly don't think I would have been able to recover if it wasn't for that group.
Yeah, I think it's incredibly helpful to have other people to talk to and get feedback from, because many of us, when we're going through this recovery, we don't have anybody else in our life that is in the same boat or understands. And there can be a lot of misinformation from other people around you who are trying to be helpful, but don't necessarily know everything about how fueling is related to menstrual cycles and all of that. So
Yeah.
having a safe place where you can, see success stories on a daily basis and, go and, share your positives, or, get advice about, this, that, or the other thing is happening. What should I do? It's, I think that it is hugely helpful for people.
Absolutely. So what is your favorite childhood memory with food?
Can I share two?
Yeah, absolutely.
So I was actually born in South Africa,
Oh,
and they have, the foods and treats are more like, there's a lot of British influence there. So one of the things I really remember growing up was the ice cream truck would come, and we would get soft serve ice cream, but with a chocolate bar. It's called a flaky in the middle.
Ooh.
And just the combination of like the crumbly chocolate and the soft serve ice cream was absolutely divine.
Oh my God.
And then the other thing is my sister and I found these sort of chips called Ghost Pops, and they're like a little ball, kind of like the cheese balls that you can get here, but the flavoring on them is just magical. And so
What are they
we
called?
actually
Ghost
would,
Pops?
Ghost Pops, yes.
I'm writing
So it's
them
got
down.
this like tomato, like spicy flavoring on it that's
Mm.
just out of this world, and they like melt in your mouth.
I'm like drooling just thinking about it, especially the soft serve. I worked in an ice cream shop growing up, and soft serve ice cream is hands down my favorite thing in the
Mhm,
world. So, oh,
mhm.
those are so wonderful. I love hearing those stories. Well, Nicola, thank you so much for coming on. This has been such a pleasure. Any final thoughts or anything at all that you wanted to leave the listeners with?
I think my final thought is that even though recovery seems really hard in the moment, when you come out the other side, the added joy that you have in your life and the understanding of your body and all of that just makes everything so worth it. So, yeah.
That's beautiful. Well, let's end there then. Thank you so much again for coming on.
Thank you so much for having me.
All right, bye.
Bye.